Mike McCool here in the Royal Examiner Studio, and with me today I have a group of, I don't know how to say this. I was going to say they're seniors, but they're not seniors. They're here to help seniors. This is part of the Senior Alliance team, and we have a new group. Last week we had some groups of people in that talked about some of the things that are happening with our seniors in our community. And Holly, she says, well, I got more. And so I said, well, bring them on. So you're here. That's how you got stuck. So I can't remember any of your names. I know Ben, but why don't we start right here? Tell us who you are and what organization you're from.
Sure. My name's Mary Parham, and I'm with Seniors First, the Shenandoah Area Agency on Aging. And we serve the broader northern Shenandoah Valley region of City of Winchester, Clarke, Frederick, and Warren County, and Page and Shenandoah. And we have senior centers in every county, and we offer a plethora of services.
Oh, yes.
And really just our mission is to help seniors age gracefully at home for however is safely possible, however long is safely possible.
So this is all part of this new Senior Alliance team, where all of these organizations are kind of like coming together. Right. And you.
Thank you. I'm Patty Fadley with Ridge Hospice. I am your care access consultant, which just means that I am outreach, basically.
Okay.
And Ridge Hospice, if you don't know, we take care of folks with end-of-life care needs.
Right.
And we service everywhere that Seniors First services, along with the City of Winchester, which I know you do, and all of Loudoun County. So we want to bring these services to folks to give them the best quality of life that we possibly can in their last days, last months, hopefully. We try to get referrals 6 months prior to that person's diagnosed passing, if you will. And typically we're getting them a lot later. We're getting them 2 weeks out. So we're really focused on bringing that information to people, as many people as we can. I talked to Mary about speaking at her church to ensure that these folks do receive the quality that they deserve.
Well, I only see 5 stars for Blue Ridge Hospice. I mean,
thank you.
And we know that because you can tell it takes a special people to take care of people at their last moments. And,
it does. It takes a special hospice.
Took great care of my mother-in-law.
Oh, well, it was our privilege.
Good.
Absolutely.
Ben, tell us a little bit about your organization. This is really a brand new organization.
Yes, we're the newest kids on the block, I guess you could say. Hi, I'm Ben Weber. I'm with Blue Ridge Independence at Home. We are a PACE organization, a program of all-inclusive care for the elderly. And unlike some of the other organizations in town, while we want to keep individuals in their home as long as possible, we provide a lot of the medical care, a full continuum of care.
Okay.
It is a type of program that it's never been done in this community before. But it was started in 1973, so it has a long and dedicated history, and we're one of 14 PACE organizations in the Commonwealth of Virginia. So we work very closely with, of course, Blue Ridge Hospice, of which we are partnered with, and then, of course, with Seniors First, who is a great organization within our community, and we work with some of the folks up in the Winchester office. But we're super excited to be part of this, and we hope that we can become a catalyst within our community.
All right. Since Ben's so excited, we're going to let him go first. So tell us now, basically, who your customers are, and because everyone has a little different niche, so to speak. And so where would a senior fit in to come and take advantage of your services?
Well, interesting enough, we say seniors, but our age group starts at 55, of which, therefore, I would be in that classification. We all might meet that, except for the young ladies we have to our left right here. Anytime.
He knows how to put the schmooze on, doesn't he?
Absolutely.
But we also have individuals that are primarily going to be enrolled in Medicare and Medicaid. So 81% of our participants will more than likely be duly eligible in those two types of programs.
Right.
And then, of course, we're going to look for those individuals that have some level of nursing home level of care required, but they have a home where they can live in, but they just need that little extra helping hand to stay in that individual home. Because ultimately what we're trying to do is to keep people out of an assisted living facility.
Right.
Now, again, we're not taking anything away from our great friends and partners at Hilltop and Seniors First and Hidden Springs. But one of the things we're doing, there's not enough beds. You and I were talking in the green room prior. Did you notice I gave you a green room?
I appreciate that,
You're
even
welcome.
though it's gray.
But one of the things we're trying to do is trying to keep people as I think somebody mentioned, just a little bit of dignity to be able to continue to age. Everybody wants to be able to stay in their own home whenever they
Sure,
can.
sure.
They might have a dog, a pet. They want to be surrounded by their things, you know.
Sure.
And so what we do is we're going to provide them that care both at home as well as at our day center that we have in Winchester at 2333 Valor Drive. And so that day center is all inclusive. It has a medical clinic with 4 exam rooms, a phlebotomy room, but it also has a day center where you can get personal hygiene, recreational therapy, physical therapy, occupational therapy, and of course our dining facility, which we love to have our partner with Westminster Canterbury provides all our food from.
Right.
So it's quite good menu.
Yeah, they have good stuff.
No, it was very good. And so it is, when I say a continuum of care, instead of having all your files and everything, trying to manage your own stuff, we can help you manage that kind of thing.
But basically, you can go to your doctor there.
Yeah, absolutely. Dr. Julie Landrio is our doctor, and she's our primary care physician, and Ruth Wenzel is our nurse practitioner. But then we have a host of other nurses, CNAs. We have a staff of about 22 at this particular time, and it's growing. And we can provide light housekeeping at home, physical therapy at home, or even Dr. Landrio can visit the home. It's all based on what your individual needs might be. If you can come into the day center, great. That will also help provide you the necessary care. And unlike many other types of insurance types of programs, we are the full insurance provider as well as the medical care provider for the time period that they're with us. Now, on average, they're going to be with us 4 to 5 years, and then they may transition to perhaps a palliative care, perhaps a hospice care situation, or perhaps they might move out of state and they could be moving and we could help them into another PACE program in another state like Florida.
Sounds interesting.
It's a wonderful program.
And the collaboration with PACE is extraordinary. It's interesting because you have Blue Ridge Palliative Care, Blue Ridge Hospice, Blue Ridge Independence at Home. They all orchestrate together to assist folks their senior time, those that have end-of-life needs. And palliative is interesting because it is pain and symptom management. Hospice is palliative, but palliative is not hospice. And that's something a lot of folks do not realize.
Right.
So with hospice care being what it is, and let me just put some kudos here to Ben.
Thank you.
First of all, he's got a great DJ voice, and I'd love to
He's got
have
hair.
that.
He's got hair.
He's got hair and a great DJ voice. You do too. But I think what I want to say about PACE is that there's so many of my folks, and when I say my folks, my partners, my clientele, the people that come to me for help, they're looking to be placed somewhere. And in our areas where we service, it's very rural. It's very up the holler, up the mountain kind
Sure.
of areas. And these folks can't always afford assisted livings. Now, nursing home is different. If there's a nursing home need, and I know you'll talk to that group at some point,
Sure.
but nursing home need, if it's a skilled need, that'll be paid for by Medicare. And by the way, we are 100% Medicare paid.
Okay.
It's a Medicare benefit for those that need hospice care. But in this case, there are several people that I'm able to say, hey, have you thought about our PACE program? When I say ours, because of Blue Ridge
of
Care, it
course.
is, I mean, I feel like we're all together.
Big umbrella, isn't it?
Oh,
It
yeah,
is
very
an
much so,
umbrella.
yeah.
And it allows folks to age in their home, to be able to stay in their home and be with their pets, be with their loved ones without worrying about the cost. If you are dual enrolled, you would qualify. We know that assisted living is all out-of-pocket cost. There's no insurance that pays for that, so that becomes challenging. So there's, even with Seniors First, there is a beautiful collaboration, orchestration, if you will, partnership that we have to make sure that folks do age appropriately and they're given the best end of care life that they could receive as well.
Sure.
So for palliative care, and I just will put this plug in for that, it's for folks that really do, they have what we would consider an end-of-life diagnosis, but they're not quite to that point.
Right.
They're not ready for hospice.
Right.
But they do need some assistance with symptom management. And Dr. Flynn, Brendan Flynn, who is our medical director, he oversees palliative as well. He does a wonderful job of making sure that our NP, nurse practitioner, or social worker, takes care of these folks. It is strictly a consultative service. However, it takes that hit off of that primary care physician that might not want to prescribe Ativan, might not want to prescribe morphine or any kind of pain control substance.
Sure.
So from that point, they easily transition to hospice care if if it works, it should be seamless, to be honest with you.
Yeah.
And we might assess somebody for hospice that's not qualified yet, but will be qualified for palliative care. So really, again, the key is to get them 6 months before, 6 months out. We want that end-of-life diagnosis 6 months out. And that could be, the diagnoses range from heart failure, Alzheimer's/dementia, kidney disease, liver disease. Oh goodness, cancer. Cancer is number one.
Sure.
So
Sometimes they fool you, and they live longer than 6 months because
And that's
because of the
okay.
care they get. I
And
can
that's
tell you,
okay,
I've
because-
seen that. I knew someone was on hospice for 2 years, and all of a sudden,
as have I.
yeah,
And it's fine as long as they show some type of decline within every certification
Right,
period,
right.
then you're going to definitely be allowed to stay on the program. But once they start an uptick of, okay, you're gaining weight, you're eating 100% of your meals,
Yeah.
you're coming out of your room, you're doing exercises, we need to look at that and really be honest with that
maybe
particular
this isn't
patient.
the place for you. Guess what? You can
We
go
have
home.
some
It
place
could,
to go.
yeah, it could come back down to a
Yeah,
pace
yeah.
situation
Speaking
and
of
a
the
positive
patient,
thing.
or palliative.
Well, I tell you, it happened to my brother. He was in Arizona, and he had a COPD issue and real bad, and they'd put him in hospice, and he's laying there in the bed, and he's thinking, and they're not obviously just pain management, you know.
Right.
And one day he just said, "I'm going to die." And he got up and took himself to the hospital, called a friend and took him to the hospital. And the guy told him, "Well, yeah, you'd been dead in another couple days." They fixed him up, kept him there for a couple weeks, and like 5 years later, then he finally passed in. But
Sure.
but again, there he realized himself that all of a sudden,
Yeah.
and he had a diagnosis that.
Did you say COPD?
Yeah, and
well,
it
those
was-
people do what we call sign waving, this up
Yeah,
and down, up
and
and
it
down.
was really he was bad, but.
Sure, but they gave him a little more time.
Yeah, gave him a little more time, and he was
yeah.
really appreciative. But again, he realized himself that I am really sick.
Yeah.
Before he was just sick, and he didn't know what to do.
And it's important for us to dispel that myth of coming into hospice and dying the next day.
Right.
We're going to give you morphine, you're going to die. That is absolutely
That's
not
why
the
I wanted to
case.
mention this
Right.
because
Yes.
sometimes you just need that care,
Correct. Yeah.
and you don't know. You may end up in hospice and not realize maybe that, and they'll evaluate you and
Sure.
say, "We got another care for you.
Right.
We got something else."
But
One thing I love about what y'all offer is your music therapy
Oh,
that
it's
you
fabulous.
have. That's
Right.
something I know that you've
Right.
mentioned before that not a lot of people come to the program early enough to take advantage of some of the more
Thank you for that.
therapeutic and beautiful things that hospice can offer because of our understanding that it is for your very, very last
right.
moments.
Right.
And
And
it
may I
is,
say, music therapy, not to stop you, but it is amazing because these folks they have a 4-year degree. It's not just bringing in a boom box and setting it on the table and
Right.
playing some old songs for this precious patient. That could really be a game changer in a negative way.
Sure.
So our folks go in with a guitar, they go in with whatever instrument, typically it's a guitar, and that is probably one of the best symptom management opportunities that you're going to see versus just giving somebody medication.
Right.
If we can bring somebody's heart rate down, if we can bring somebody's breathing to a normal just by the simple strum of a guitar, and these people are masters at what they do. I've seen it happen. I've seen a music therapist in
Yeah.
the corner of a room with the back to the patient. The patient has labored breathing, and that precious music therapist, she's playing her guitar, matching that heart rate and that breathing, and slowly strums it down, and the breathing strums down. So it is a scientific fact. So thank you for that, because
of
not
course.
all hospices have music therapy. We're
Right.
the only one in the area that does have it.
Well, the brain is a miracle organ, isn't it? I mean,
Truly, it really is.
And,
And
and
we haven't figured out how that thing works
No,
yet.
no,
At
yeah.
least I haven't
Well,
figured out
I
how
don't know
mine
we ever
works.
will.
in my younger days, I don't know if you remember Norman Cousins. Remember "Laughter is the Good Medicine"? And
I do remember
basically
Laughter,
remember that
yeah.
story. And
Right.
well, treated cancer, or I think of what it was, just with telling jokes.
Sure,
and
sure.
just getting the mind. And so we're wonderful made.
It
I
is.
think that's a perfect segue into some of what Seniors First does
Okay.
too, because we are also learning more about the onset of Alzheimer's and what leads to that. And one thing, we know nutrition makes a big difference.
Sure.
Social isolation is a huge bad contributor
Sure,
to
sure.
that, right?
Unfortunately,
and
yeah.
so one of our And then often people don't know where they're at in that process, right? So we kind of get into, our seniors get into their rhythm. They're in their home, maybe surrounded by their things. Their people come around, but maybe not very often. They don't get out that often. So one of the ways Seniors First starts to help our community is that we have our senior centers where either seniors find us or maybe their families find us and know, hey, mom's not getting out of the house as much and we want her to be able to come over to interact with her neighbors, or someone they need a meal every day. And so what our senior centers offer is we run shuttles that will go pick up people near the senior center. They will come in for morning activities, open 4 days a week, either Monday through Thursday or Tuesday through Friday, depending on the area. And they come in for morning activities. We'll have like Shenandoah University music students come to
wonderful.
Winchester Senior Center. We have volunteers come and do different programming, even some movement classes, chair yoga to get them engaged.
We've actually sent some of our dietitians over to
Wonderful.
to the senior center over there to talk about food management and how to eat the right foods.
I can remember our previous sheriff, Bart Butler, would go to the senior center here, bring his
Oh, they
guitar.
loved him.
Oh, love Mark, and he would go over there and just have a jam session, and it was great. And a lot of people do things like that. And
We've got lots of local community volunteers and organizations that like to come, and that's how we introduce our seniors. We're not we protect them. We want to make sure we're never sending someone in to sell them something.
Right, exactly.
But we're that vetting source too. So we often act as kind of the first stop for, we see mom come in, we're seeing her at the senior center. We start to notice a little bit of maybe some cognitive issues or what have you. And then we can start to talk to the family about it. We can refer them to other services. We have a hot meal that's served every day at our senior centers, but we also do Meals on Wheels. That's how most people know us.
Sure.
So, and one of you touched on how rural our populations are too, which is a huge issue for us. Not everybody is within a reasonable range of a senior center or a route that delivers meals. So we partner with Mom's Meals also that will mail out frozen meals to folks a few at a time so that they have that. And then we also, because of our grant funding, we work with lower income seniors to provide those services at different rates. A lot of them are eligible for little or no payment for those services. We work with home health agencies to come in and work with people who need a little extra personal care or for respite care, helping members of their family with dementia. So essentially, we like to be the first call. When people call us, we can then refer them elsewhere if we don't offer the service. And Ben talked a lot about how your organization is insurance and the provider, which is wonderful.
Right.
So we have referred some folks over to you.
Yes,
We also have people that come in just who are new to Medicare. One thing that we offer is I actually run our SHIP program, which is a state health insurance program. So we're state certified to help people navigate Medicare. If they a little bit of Medicaid, but we try to refer them to DSS, Department of Social Services. But we can often be I'm that first point of counseling for people to know what benefits they may be eligible for that they're not getting and how to navigate it. And we're not insurance agents, so we're not, there's nothing in it.
scary
We have no
world.
skin in the game, is how somebody put it to me recently, which is comforting.
And I have to say, the commercials that are being bombarded on TV land and the channels where seniors are going to be watching, it's all about Medicare Advantage, and seniors don't realize that you have a choice right between that and supplement. So I think I know that you cannot sell them on one or the other, but you provide them with the appropriate information to make a really smart, intelligent decision.
Yeah,
on what to do.
what you're referring to is marketing at first, which we always have to know marketing comes from a budget. Right. So there's a for-profit element there you immediately can have a red flag about. But also this marketing is a violation. They're advertising. Every one of those advertisements is when you call, that's not what you get. And there's all sorts of loopholes.
Well, and I try to encourage people, it's all great. We always say click send and hope for the best.
Yeah.
Oh my
And
God.
and that's the thing you're getting, because they're selling this all over the country.
Yeah.
And independent agents are kind of dying off. We have some, and you don't realize how important people are. And you mentioned they're your navigator through things that where you need to go and if they specialize in one thing, they know that's this, and it changes every year. And so just because you had it last year doesn't mean your plan. Well, I have the same plan. Well, it's 100% different.
It's completely different animal.
And you need to know that.
One of the things that since we're overseen by CMS, the Center for Medicaid and Medicare Assisted Services, and DMAS, the Department of Medical Assisted Services for the state, we can't go knock on Mr. Jones's door.
Right.
That is that's predatory marketing at this point. And the seniors right now, as we saw in the recent article, $2.6 million scams from seniors within our community.
Within Strasburg and Woodstock.
Yeah, it was awful. It was awful. So we're very cognizant of that, because we want to make sure that, in each of us, we try to refer within our systems. We get to know that. We trust each other, and we trust the seniors, and the seniors hopefully trust us. But one of the other things, we work very closely with the Department of Social Services. They recommend us because they have individuals that have already applied for the Medicaid process. And one of the key other aspects is that we'll go out, at least Blue Ridge Independence, we will go out and speak to church groups, civic-based organizations, because I can't go to Mr. Jones, but I can go to the organizations that Mr. Jones might belong
It's a
to, or
wider
Mrs.
reach,
It's
too.
a wider reach, right?
Sure.
And so that's one of the key things that we're trying to do, is get within the community, spread our wings as much as we can, and let everybody know that they can go to www.brih.org and find out more about Blue Ridge Independence at home.
Can you, if I might interject, and I have questions for you too, would you share the fact that you were able to, I don't know if the word is purchase zip codes, but there's certain zip codes that you have with Blue Ridge Independence at home that don't necessarily come all the way down, specifically Shenandoah County or Page County. If you would just
So
share
when
about
we
that.
applied for the opportunity to open up a PACE program as under the entity of Blue Ridge Independence at Home, along with Blue Ridge Care under that umbrella thing, they gave us a designation of 76 zip codes, and it wasn't based on county; it was strictly based on zip code. So we have 3 or 4 zip codes down in the Shenandoah County, but we don't have Woodstock. But we have Murraytown North,
Murraytown and
right?
Tomsboro
But then
and
we have all of
Strasburg.
Rappahannock County, but we have also Warren County, but we don't have all of Fauquier County or Page County. So we have a nearly 2,000 square mile area. And we're planning, based on that, we know that there's a need. I mean, that's why they gave us that designation. And so by working closely with organizations such as Seniors First, Hospice, the hospice bereavement and grief and loss program that was in addition to the music therapy, we again act as that catalyst. We get referrals from certain individuals. We can assist people with their Medicaid application, and by being able to provide them that continuum of care and that all-inclusive sort of organizational through their medical care, we can keep people in our programs for 4 to 5 years and keep them at their home, but also providing that necessary respite for the family member that might be involved. But in a lot of cases, they may not have any family at all. And that's where that loneliness disease that is affecting our seniors in our community right now, that it's really making it really difficult for many seniors.
I think that the resonating word here, if I may, is multidisciplinary. We are all in this together. Seniors First has a multidisciplinary approach, as does Blue Ridge Hospice, as does Blue Ridge Independence at Home. And because of that, that adds to the success of making sure our seniors are cared for appropriately.
Well, you mentioned age 55. When the AARP brochures start coming in your mailbox, we know that we're transitioning to being a senior. And I think as that case, it's hopefully a long period of time, especially when it starts at 50 or 50. Now, I think they keep moving it younger. Right. But around 50, 55, we start that transition. And I think people be aware that we have services at all different levels, starting at 50, 60, 70, 80, 90, and 100 and up, So that our community will help us transition to really, and so that we can have golden years. And
That's
there's a lot of
absolutely
us.
a fact.
And
Well, and the
there's a lot
baby
more
boomers
coming.
are coming up quickly.
For the next
Yeah.
20 years, there's going to be a lot
it's
of
gonna
the
be-
senior community for the next 20 years. And then it starts to peter off a little bit
Sure.
at that point.
It's
But I
gonna
think
change
that we just need to be
exponentially.
aware that if you need some assistance, reach out because, maybe you'll reach out to one person. They can't help you, but with this Senior Alliance organization going
Correct.
on now where we've got together, we'll be able to, okay, I can't help you in my organization, but over here.
And that's exactly what's happening right now.
Yeah.
I mean, I spoke with an individual this morning, and I can't help them. I can't assist them. They had too many assets, but yet they still needed a level of care. So I sent them a list of individuals that they
Yeah.
need to give out and reach
Well, I
out
know
to.
you mentioned social services. Michelle and them put on that one-stop resource center, which
Yes.
you all go
We
to.
do, yes.
And if you want it, and they do this every quarter. So if you think you want to just know what's going on, or if you want to volunteer for an organization, this one-stop resource center is the place to go because you
Absolutely.
can all use volunteers.
Oh my goodness!
And I
yes.
would love to add to that, the call to action is when you start getting that deluge of, hey, you're a senior, mailings and information, try to see through that wave.
Right.
Because the people who are reaching out to you, don't want to paint them all in a bad light,
Sure.
but they're not all the organization. You don't know what you don't know.
Exactly.
So reach out to one of the community organizations and then we will refer you in the right direction. One of my favorite calls to get is from children or loved ones of a family member to help them prepare for this
Right.
golden age.
Right.
Ahead of the game, we will always help someone who has found themselves in dire straits or in some kind of an issue.
But we wait too late.
Right,
Right.
but and I
Unfortunately,
think
it's
that's probably the same for
Exactly.
y'all too. When we
Yes.
get
Absolutely.
those preparatory calls,
Yes.
it heartens me because then I
Sure.
get to lay out these are your options.
Yeah.
You
Sure.
have all the options.
Right. Well, we're going to go ahead and put links to all your organizations below in the story so people can, ones that can, that are not technically challenged like
Right.
most of us, can get on there and find out more information. And we'll be glad we'll have you back. And I'm sure that we've again talked to Holly about the Senior Alliance team. So that's why you're seeing these group of organizations come through the Royal Examiner because we've got several months of this going on that we've booked this ahead of time because there's so many services
Oh, yes.
that people have just never heard of. Just never heard of.
Yeah.
And we really appreciate you coming and sharing.
Yeah. Well, thank you for this vehicle to be
Yeah.
able to share
We
this.
appreciate
with you.
that.
And if I may, I'm going to take this opportunity.
Sure.
If anybody would like to come and visit the PACE organization to come and see a tour and see it firsthand, love for them to stop by. They can always reach me at the contact information provided.
Sure.
Love to be able to give people a tour because, as we all know, education is very, very important.
Sure.
And if you can touch it and feel it, it's actually true.
Right, right. So
And
we,
the same goes for our senior centers. They're open for visitors.
Right.
There's no formal invitation. You can go on to seniorsfirst.info or reach out to our main office and we'll give you that information and set up a time for you to come
Sure.
and
And they're very lively. by
They
the
are
way.
very
oh, I was going
lively.
to say,
I
I've
think-
been
Yes.
over to the Senior Center.
Yeah, it's
and
not
yeah.
what a lot of people think
No,
of when
it's
they
not
think
at
of
all.
senior
No.
centers.
And they have a
So-
great staff over there too. I know Tina over there in
Oh, yeah,
Winchester.
Winchester's
She's a hoot.
lovely.
Yeah, absolutely.
And I want to interject as well, since they're talking about their centers. I have to throw this in. We do have an inpatient care center. It's an 8-bed unit. It's for folks, we call it general inpatient opportunities or respite care for people that need some pain and symptom management, but maybe 24-hour, round-the-clock help that cannot be given at home or in an assisted living facility
Right.
or even a nursing home. So they're
That
8
respite
beds,
is a
and
good
it's-
word because
Yes.
Yeah.
It's vital.
it's vital. And again,
For caregivers.
caregivers
and-
are,
yes,
are
go on
it's
vacation.
they get down and then they're
Yes.
just like their patient.
Yep. And they
You're
need to
right.
get their
Worse.
batteries recharged as well.
Yeah,
You're
yeah.
absolutely right.
Well, again, I really appreciate you coming in and we'll see you again soon.
Thank you.
All right?
Thank you.
for the
Thank you very
opportunity.
much.
Yeah.